anything can cause a torn meniscus. If it's the medial meniscus, most likely it's a twisting or an impact that causes it. Absolutely. Because of that extra attachment we talked about, it just doesn't float. So it sometimes gets stuck and then gets pinched. And some of it has to do with the weight of the meniscus that's on it and the wear and tear, along with the trauma if we're carrying a backpack. I've had a lot of people that come back from the war and they carry 150-pound backpacks and they're on their third tour. And their knees are shot. And he's like, look, I've got a year and a half to get my 20 and I want to fulfill my duty to my country. I'm like, I'm your man. I'll do it for you. If you don't have insurance, I'll take care anyway. Because I love to help the vets. I worked at the Brooklyn and Manhattan VA, and I just loved working with the vets. So it depends on the trauma, the degree with which it is. As we had talked about earlier, if there's any tears that are significant in the meniscus, and to what degree the tear is. Now, with relief, number one is proper biomechanics, no twisting. Number two is try not to stress it more. If you go to exercise, strengthen the joint, but don't put weight through it. Pull, open chain. 3 is you can replace the fluid. 4, if you actually have a tear, have your local orthopedic surgeon look at it and say, do I need it scoped and cleaned up and shaved and so that everything is as smooth as it can get? Because when it is frayed and fringed, that gets caught between the knee and it hurts. So when they are clean, like you've just had yours cleaned up, that also can be very, very beneficial so that it will allow it to function normally. So a scope, they take the 3 holes, they fill it up with water, and they basically shave off all the rough edges. Sometimes trim back the meniscus if it is frayed or split. There's an interesting thing about the meniscus. On the outside third, it has vascularization. On the inside 2/3, there's no vascular supply, which is also one of the primary reasons why the majority of people with knee pain have problems on the inside, because it doesn't heal. There's no vascular supply. A lot of people don't know that.